Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillahir Rahmanir Rahim. We will begin with a hadith about joints. It was narrated by Abu Dawud radiyallahu anhu from the Prophet, peace be upon him. I quote, "A sadaqah, which is a deed of charity, becomes necessary upon every joint of the body each morning. Thus every subhanallah is a charity. Every alhamdulillah is a charity. Every la ilaha illa is a charity. Every Allahu Akbar is a charity. And enjoying good is a charity. Forbidding from evil is a charity. And suffices on behalf of these are 2 rakats of salah at mid-morning." The 2 rakats to be read every morning is easy and practical. Think about it, about 5 minutes of your day every morning, and you have given charity for every joint of your body. How merciful is our Creator that He presents a task to us and then provides a solution that is so simple and easy to perform with a reward that only He can measure. Furthermore, in keeping with the sunnah of our Nabi sallallahu alayhi wasallam, we should be thanking Allah subhanahu wa ta'ala for all His benefits. Let's not forget to thank Him daily for our functional limbs and joint which we take for granted. We have in our studio today is Dr. Ayesha Wadee, and I would like to welcome her on Health Matters on behalf of the Islamic Medical Association. Dr. Ayesha Wadee is a rheumatologist and a general physician by practice, and she has been in practice for the past 3 years. Assalamu alaikum, Dr. Wadee.
Wa alaikum assalam.
Welcome to ITV. If you can tell us, what is rheumatology and the scope of rheumatology, if you can explain to us.
Rheumatology is basically the study or the science involving the immune system and immune-mediated and inflammatory diseases. All the arthritis, you get like rheumatoid arthritis, osteoarthritis, many different forms of arthritis, of which there are many. We also deal with other autoimmune or connective tissue disorders, and these are disorders where your immune system attacks either your joints as well as other organs in your body. And also some of the chronic pain syndromes as well as the soft tissue rheumatism is also part of what we deal with.
So what actually causes arthritis?
When a patient presents with pain, or say a patient comes in and says, "I've got pain in the shoulder," the important thing is to know where is the pain coming from. Is the pain from the joint itself? The joint is the 2 bones meeting, but there's other structures around that as well, like tendons, ligaments, and fluid pockets and bursa, which can also cause the pain. Or it can also be radiated pain from other areas. And it also may be pain that's not related to specific pathology on the joint. If I go to slide number 1, we could see there's different things that cause joint pain. So it can either be from joints itself or from the periarticular or soft tissue which join and bound the joints, or from other areas of the body.
So what is slide number 1? What does it speak to specifically?
It just gives an idea of where exactly the pain, where it can be originating from. So, if you go to slide number 2, I've got a picture of a normal joint. So, like I said, you can have articular pain where it originates from the joint surfaces itself. And when it's that, you can either have inflammatory types of arthritis or non-inflammatory arthritis. It can be from the periarticular surfaces, which are the surrounding tissues. If we go to slide number 2, I can show you a picture of a normal joint. And you can see that we've got a normal joint, and the area where we're talking about is the cartilage or the cushion that occurs between the joints, and that's the main area which is involved with true arthritis. But around the whole area you've got ligaments and cartilage and everything else which can also be involved and give you pain. Basically, we have different forms of arthritis. Inflammatory arthritis specifically is things like rheumatoid arthritis. And with rheumatoid arthritis or other inflammatory diseases, these are diseases that can occur at any point, any age. It's more patients who have swelling of the joints. They also complain of early morning stiffness. And especially if a patient has got stiffness and feels like it's difficult or stiff to move your joints, especially first thing in the morning, that is more inflammatory arthritis. And especially if it lasts for more than 30 minutes, we have to worry about that being inflammatory arthritis. Connective tissue diseases, for example, lupus, can also give you an inflammatory arthritis. And that type of arthritis may be associated with other things. So patients who have an arthritis, as well as patients who have skin lesions, need to worry about having it checked out because it may be a form of significant inflammatory arthritis. Osteoarthritis, on the other hand, is one of the non-inflammatory arthritis, which is what we call the wear and tear or the degenerative arthritis. Osteoarthritis is more likely to occur in older patients or patients who have had a previous injury to a joint which predisposes it to getting earlier wear and tear. And then you have patients who may also have joint pains without swelling or without anything specifically wrong on the joint itself. And when they have that, we refer to it as arthralgia because there's no deformity or no abnormality on the joint itself. And then the periarticular or soft tissue pain is also something that causes pain. So in the shoulder, you've got all your tendons that go around the shoulder, that all your muscles that are involved in the movement of the shoulder. You can have inflammation of the periarticular structures, which is the tendon, muscles, or bursa, and that can also give you pain. And you can also have referred pain to a certain area, and sometimes pain in a joint may not be pain originating in that area, but could be an indication of other types of disease. For example, again, shoulder pain may not be pain originating from the shoulder, but could also be a marker of something happening in somewhere else of the body, specifically if you have shoulder pain for something happening in the abdomen.
Dr. Wadee, in terms of prognosis, you've described osteoarthritis, rheumatoid arthritis. You've talked about inflammatory, non-inflammatory. In terms of prognosis, is there a cure for the different kinds of arthritis that you have mentioned?
Different types of arthritis have different things. Most types of arthritis are not curable. However, especially with the immune-mediated or inflammatory arthritis, you need to treat those diseases to get the arthritis into remission. And remission is a target which we can achieve. And if we get the disease into remission, we can prevent damage to the joints. Osteoarthritis, on the other hand, which is a degenerative arthritis, we don't have cure for that, but we have to treat it to prevent or to slow down the rate at which progression develops or the rate of deterioration. The important thing in treating any joint disease is essentially to keep the patient functional. And that's the main reason why we want to address arthritis as a problem and treat it, because we can maintain function in the patient. It's also not something that a patient needs to live with. Pain can be treated, and that's what can improve your quality of life.
So when you make reference to functional, what is it? What would you recommend in terms of lifestyle, treatment, behavior? What would you recommend to your patients out there?
The different types of arthritis, again, need different treatments and different things. Some types of arthritis do involve lifestyle changes, okay? Osteoarthritis, gout, weight is an important part in terms of these forms of arthritis. Specifically with osteoarthritis, it's important for us to maintain weight in the patient because your joints are weight bearing and they're carrying that weight around. And if you've got an increased weight, it allows for earlier degeneration and deformities on these joints, okay? Then if you take things like gout, gout is a disease that is a lifestyle disease, and diet is important, okay? Especially high red meat, cholesterol, sugar, all of those things also influence the arthritis. Rheumatoid arthritis, not specifically related to diet, but one of the risk factors for things like rheumatoid and immune-mediated arthritis has been shown to be smoking. So smoking is also something which we need to reduce to decrease the effects of rheumatoid arthritis or the severity of rheumatoid arthritis.
You mentioned lifestyle. I haven't heard you mention anything about exercise.
Exercise is important in every specific form of arthritis. Important whether it's rheumatoid, osteoarthritis, gout, or any form of arthritis. Most patients, when they have an arthritis, say that they don't want to exercise because it's painful on the joint. However, if you don't exercise, you will worsen any form of arthritis because it will lead to muscle deformities and muscle wasting and muscle weakness, and then you're going to change the alignment on your joint, which will make exercise, which would make your power worse and your function worse. When you do exercise, especially with things like osteoarthritis, we have to do like more muscle strengthening exercises as opposed to specific weight-bearing exercises. And specifically with things like osteoarthritis and even rheumatoid, one of the better forms of exercise is things like aquaerobics or hydrotherapy and Pilates in terms of those exercising, and less beneficial are things like treadmill because of knee weight-bearing in patients.
You haven't mentioned walking.
Walking is a good form of exercise. It's a good form of generalized cardiac exercise, and it also maintains your cardiac disease, which is one of the risk factors in patients having rheumatoid arthritis. The only problem in terms of walking is if patients have arthritis of the knees and they've got bad osteoarthritis, sometimes walking may not be very efficient in those patients because it's weight-bearing as opposed to muscle strengthening exercises.
Also wondering, earlier on you mentioned about arthritis attacking different ages. Is there any specific age category which arthritis attacks, or does it affect people across the spectrum?
Arthritis can occur across the spectrum. There's nobody that can't have an arthritis, but different forms of arthritis occur in different age groups. So with children, even young babies can have things like juvenile arthritis, which is known to occur in children. Connective tissue diseases like autoimmune diseases can also occur in children. Most of the immune diseases, rheumatoid arthritis, lupus, these are diseases that are more common in females of childbearing ages, and decreases as you go much later, although with rheumatoid there may be a peak later on in life as well. Then gender-specific, women are more likely to get immune-mediated arthritis. Women are also more likely to get things like specific forms of osteoarthritis. And then with men specifically, the one type of arthritis that is more common in men is the ankylosing spondylitis. In terms of ethnicity, there are certain things that we see more commonly in certain populations. For example, in the Indian population in South Africa, one of the types of arthritis that we also see more commonly than we see in other populations is something like psoriatic arthritis. And then weight is an important thing. People who have increased weight, we're more likely to see osteoarthritis and again psoriatic arthritis. And now with the emergence of the so-called metabolic syndrome involving diabetes, hypertension, we see things like gout and psoriatic arthritis emerging more commonly as well.
I'm not sure if everybody's understood what psoriatic arthritis is. If you can explain that, please.
Psoriatic arthritis is a type of immune arthritis or inflammatory arthritis that occurs in patients. It's associated with having skin psoriasis. Not every person has to have extensive skin psoriasis to have psoriatic arthritis. They may have limited or hidden psoriasis, and the arthritis may sometimes even occur before the onset of the psoriasis on the skin.
Dr. Wadee, just wondering in terms of arthritis and the connection to it being transferred, if it's a hereditary disease, and if which form of arthritis is more likely to be transmitted to the next generation?
Genetics play an important role in most forms of arthritis. In most of the immune-mediated arthritis, there are genetic relationships, and there's been specific genes in families that have been identified. However, genetics alone do not explain everything. It doesn't mean that everybody in a family will have that type of arthritis, but there is a higher incidence of certain types of arthritis within specific families. We believe that there would be a gene, but something in the environment, whether it's smoking, whether it's hormones, whether it's infections, we don't know all the causes, but something may trigger that gene to become active and produce antibodies which then attack the joints.
Is there anything else you feel that the viewers out there need to look out for, the telltale signs, the early telltale signs? You know, what you mentioned earlier was the stiffness and for more than 30 minutes, but are there other symptoms that are not easily detected and that people need to look out for?
I think importantly to have ongoing joint pain in a specific area that doesn't just go away, that you have early morning stiffness. Don't think that if you're a young patient you cannot have an arthritis. In the same way that when you get chest pain and you worry about it being heart or other things, we should treat joint pains in the same way. It's not normal for young males under 40 years of age to have backache, and especially if you have backache that's waking you up from sleep. Rather have it checked up. If you wake up in the morning and you feel stiff and it takes you more than 30 minutes before you feel like you can move, if you notice that you got swelling of your joints, those are things that you need to see. Also with inflammatory and immune-mediated arthritis, look for rashes, look for other abnormalities on the skin, look for other symptoms. Eye signs are important. Patients may have recurrent eye problems. You may have ulcers in your mouth, you may have skin rashes, you may have gastrointestinal problems. And if you got those things, rather have it checked out. And other things are things like weight loss. Weight loss and fatigue are also a form of inflammatory arthritis does give you weight loss and fatigue. It's part what we call constitutional symptoms. And if you got that, rather have it checked out. There should be no pain that continues without knowing a cause for more than a few days.
You mentioned, when we talk about arthritis, it always seems to be synonymous to joint pain. But just in terms of clarification, does it affect the internal organs?
Yes, especially the immune-mediated arthritis. Rheumatoid arthritis is an immune-mediated disease which has a predilection for the joints but doesn't exclude it affecting other organs. We can have involvement of the eyes, we can have involvement of the blood vessels, we can have involvement of the lung, we can have involvement of the kidneys, and we can have involvement directly by the immune process, but remember that we also need to treat these medication with different, these diseases with different treatment, and side effects of some of the treatment may also cause problems in certain organs. Also, we know that patients who have an inflammatory arthritis or an immune-mediated arthritis have an increased cardiovascular risk and have an increased risk of heart attacks.
Okay, we will be taking a short ad break and return to Health Matters on ITV. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters on ITV, organized by the Islamic Medical Association. We have Dr. Ayesha Wadee, who is a rheumatologist and general physician, talking to us on arthritis this evening. Dr. Wadee, just to recap on chronic pain and arthritis, if you can speak more to that.
Yeah, besides what we've discussed about the inflammatory and non-inflammatory arthritis, you can also get these chronic pain syndromes and things like fibromyalgia, which is becoming a quite common thing that occurs now in the population. And these are syndromes in which people experience true pain. pain in multiple areas of the body, pain in or in one section of the body. So some people may present with acute debilitating pain in an arm or limb. Others may present with generalized pain affecting all the body. They may have sleep disturbances. They may have psychological things associated with it, which also is some of the chronic pain syndromes that we address when dealing with patients in rheumatology. Fibromyalgia is one of the common disorders that we do deal with, associated with things like depression as well, and sleep is a big problem in patients with fibromyalgia.
Thank you for that, Dr. Wadee. We would just like to remind the viewers to call in on this number on 011 086 7701 or 2 or 3. So you were making reference to people suffering from sleep disturbances because of the chronic pain. Do you have any recommendations regarding that, Dr. Wadee?
You know, it's multifactorial. What starts first, what it leads to, but some patients who have sleep problems can end up having chronic pain syndromes. Patients who have chronic pain can end up having sleep problems, and this can lead to you being functionally incapacitated, and you become dysfunctional. You can't concentrate on doing things. It takes you longer while to do things. You have chronic muscle pain and tender spots and tenderness all over your body. You can't exactly point in one spot and say this is where it's painful. We do have medication which we do use to help these patients treat these diseases. Although it's not medication alone, together with that we have to do a full exercise program together with psychotherapy and things to help correct the sleep disturbance as well as treating chronic pain. There's nobody who needs to live with pain. Yes, we always worry about, what happens if I take pain medication? Will I become addicted to pain medication? Will pain medication give me a problem? Yes, we're not saying take pain medication just uncontrollably, but don't live in pain, because if you live in pain, you cannot do your daily functions. And if you cannot do your daily functions, it doesn't give you any quality of life. You need your joints to not be painful, to do everything every day. With joint disease, it's an important thing. We take it for granted a lot of the times, but everything that you do, your walking, your eating, how you wash yourself, whether you wash yourself in the toilet, whether you wash yourself in the bathroom, if you don't have functional joints and muscles, these things become impossible to do. And you only realize, once you don't have that, how dependence on people are not what we want to achieve. And that's why we want to treat these diseases and keep you as functional as possible for as long as possible.
So what you're saying, Dr. Wadee, is that nobody needs to suffer in pain, that people don't need to endure this unbearable pain.
No, there's no need to endure unbearable pain. You need to get help to help you with the pain.
Just a reminder to the viewers, we are taking calls in on 011 086 7701 or 2 or 3. The number is on the screen. People, please feel free to contact and call Dr. Wadee for any kind of concerns or worries that you have regarding joint pains. Dr. Wadee, in terms of, taking medication, I think often the concerns are, as you mentioned, the fear of addiction, but the fear of it affecting other internal organs like the kidneys as well. What is your response to that?
That is why you have to take medication in a controlled environment on the advice of your doctor, with monitoring from your doctor to to make sure that you don't develop any side effects. By not treating pain, you're also going to have side effects. Immobility increases your risk of heart disease. Immobility increases your risk of other things. Immobility increases your risk of osteoporosis. If you have pain, you're not going to be able to exercise. If you can't exercise, you're going to get other complications. You're going to get contractures. You're going to be dependent on people if you're unable to physically exercise. And it's all about function and maintaining your function, and that's where we want to treat and treat arthritis so we can keep patients functional.
I haven't heard anything, or you haven't mentioned anything regarding physiotherapy as one of the forms of intervention or support?
In terms of rheumatology and any form of arthritis, it's a team approach in whatever we do. It's not just a medicine, take your medication and go. With joint disease or with autoimmune diseases, it's a multidisciplinary team. Besides the doctor, you need your physiotherapist, you need your occupational therapist. Sometimes they need to build splints for you, working aids for you. They may need to make your home more friendly so that it's easier for you to do things and maintain function. You may need certain utensils to be built for you, so things like eating becomes easier to do if you've got problems with your joints. A simple thing like opening a door, opening a tap, all of those things are some things which patients with arthritis can't do. Can't open a bottle easily because of joint pains. And in cases like that, we may need to get appliances from the occupational therapist. The physiotherapist needs to help you with joint protection and joint strengthening exercises to maintain function. Also, when treating these diseases, we also sometimes need a psychotherapist to also help deal with the psychological impacts of having a chronic disease and treat it holistically. Exercise, besides physiotherapists, we may need to get a hydrotherapist, we may need to get a biokineticist involved. We also need to get dietitians involved in a lot of our diseases because there are diets and lifestyle issues that impact on these diseases.
So what you're saying is very clear, that a multidisciplinary approach is critical to the well-being of the patient and ensuring that the patient gets all the multi forms of intervention in moving forward. Are there any other things that you would like the viewers to be aware of or to be alerted to, and what they really need to look out for?
You know, the other thing that is important to realize, besides speaking about arthritis in terms of it being just joints and surrounding structures, sometimes if a patient has joint pains or joint disease, it may also be a manifestation of a disease somewhere else in the body. Okay, things like certain metabolic diseases can present with joint pains. Certain things like diabetes can have implication on the joints. Sometimes even things like specific cancers may present with joint pains or bone pain as the first form of the disease. Then other metabolic things and other crystal arthritis and other things that can be wrong in your body, the first sign that you may find may actually be in the joints. So it's important to go and have your joints checked early on.
So it's important for people out there to actually visit their doctor and have things attended to see their general practitioner or their physician.
Yes.
They need to be more diligent on that and not just let it and actually take medication just behind the counter, go to self-medicate.
Yes. Just on a point with self-medication. Self-medication is one of the worst forms of medication we have. The problem is when you self-medicate, you don't realize what the true ingredient in a specific medication is. And that's one of the problems we find. Is the reasons patients have problems in terms of organs and medication is not always because they're taking the medication in the correct doses, but they're taking medication from different healthcare providers or different pharmacists, neighbors, and anybody that gives them any pain medication. And that may all have the same ingredient. Even a thing like paracetamol may not be is one of the worst drugs in overdose. But if you're taking 3 different formulas, so you may go and buy Miprodol, which has got paracetamol, plus Panado, which has got paracetamol, plus the green Stopain, which has got paracetamol. Taking all of those together will give you an overdose of paracetamol. So to do that, that's not something which we should do. That's where you need to go to your healthcare practitioner. Every time you go to your healthcare practitioner, take all your drugs with you so that you don't get duplicate prescriptions on pain medication, which has the same ingredient.
Now, just continuing on that self-medication, we often listen to the radio and they talk about osteo-ease for arthritis, advertising these kinds of medications. What is your take on that?
With regards to things like osteo-ease, arthro-guard, and a whole lot of those things, the thing is they've got ingredients which we call chondroitin and glucosamine. In terms of specific medical trials, they haven't been shown to be totally beneficial in everybody, but they may be beneficial in a small proportion of these patients. Specifically in a disease like osteoarthritis. Osteoarthritis is not a disease which we have specific immune modifiers or specific drugs to treat osteoarthritis currently. And besides pain medication, we're at a loss in terms of looking for something that makes a difference. I always advise my patients, especially those that have osteoarthritis, try one of the formulas, but you need to try it for 2 to 3 months to see whether it actually works. If you feel that it's working for you, then it's worthwhile continuing. But if you feel it's making no difference to you, then it's not something that I would continue.
Okay. Something that's often noticeable is that people with arthritis, as they age and as it progresses, depending on whether it's in the back or the neck, it affects their posture. What do you say about that? You know, what is your response to that, or what would your advice be to patients around that?
That's where exercise and biokinetics and everything plays an important thing. The reason for the posture, besides what happens in the joint, very often the posture that becomes the greatest of problems is related to spasm in the muscles, which is caused by irritation on the joint. So it's not, and what happens is if your posture is not correct, it also allows more wear and tear. Osteoarthritis is almost like the car's tires. If your alignment is out, you're going to wear those joints more often or quicker. So you're going to wear your tires out if your alignment is out. And that's where posture and exercise and muscle strengthening becomes a big beneficial thing in osteoarthritis, because if we can correct that, we can slow down the progression of degeneration in these joints.
Now, you mentioned osteoarthritis, and if we look at sleeping habits and sleeping patterns and the kind of beds and pillows that patients who are suffering from osteoarthritis in the neck, what would you recommend to a patient out there?
Different types of arthritis, different joint mechanisms, different mobility, different patient comfort. I think that you'd have to work out in terms of what is good for you, in terms of what gives you good support. There, your occupational therapist, your physiotherapist, and your biokineticist would be a better guide.
So they would have to look at the allied health professionals, yes, for that kind of support in guidance.
Yes.
Okay. Just a reminder to viewers out there, we are taking calls on 011 086 7701 or 2 or 3. Dr. Ayesha Wadee, who is a rheumatologist and general physician and would be willing to advise on joint pains, as her area of speciality is arthritis. If there was anything more specific or something that really stood out for you as far as arthritis is concerned, what, if you had to just single out something, that one of the most important indicators, what would you choose?
Function. The best thing about treating a patient with arthritis is to see how the patient physically improves in function. Like I said, you don't realize the impact that your joints give to you. And with your joints not working, with pain in your joints, it has a great impact on you, both physically, emotionally, and psychologically. And if you can treat that patient sufficiently enough to return that patient back to a function and maintain their function, that's the important thing. Today we have drugs that if patients have rheumatoid arthritis, it doesn't have to be a disabling, deforming disease. Today we should be treating rheumatoid arthritis in the same way as we treat heart attacks, in the same way as we treat diabetes, in the same way as we treat other chronic diseases. We've got a whole lot of drugs that are available, and we should be treating these diseases to target. And if we treat these diseases to target and treat these patients to remission, these patients should be leading a normal life, should be able to maintain work and function and continue life as normal as possible.
So what you're saying is that in essence, people could continue to be not only mobile but productive and continue to make a valuable and meaningful contribution, not only within their lives but also outside of their own lives.
Definitely. And remember, especially with these immune inflammatory diseases, these are diseases common in the young working population. Arthritis is not only a disease of the elderly. Very often people ignore arthritis and think that they're not old enough to have arthritis, and because of that they don't seek help. Also, very often with arthritis you tend to ignore it and say, I must have injured myself, I must have done something to the joint. But if you have pain that is ongoing and you can't remember injuring your joint, please rather have it checked out. Important thing also, if you've got hand pain and the small joints of your hand, if you've got swelling or pain in the small joints of your hand, it's also important to have that checked out, because most immune-mediated disease, specifically things like rheumatoid arthritis, does affect the hand, and specifically the small joints of the hand.
Dr. Wadee, regarding the hands, you mentioned the hands and those hands become disfigured. Is there any kind of cure around that? I mean, what can be done to prevent it, or how could it be improved?
We should not be seeing disfigured hands. Today, we should be treating the patient when they have the swelling so that we don't lead to disfigurement. Okay? Treat the inflammation to prevent destruction to the joints, splint those joints, use appliances, and we even have surgery that's available. Today, with arthritis, we also do a lot of musculoskeletal ultrasound and joint ultrasound. So it's also easier to pick up arthritis and treat arthritis earlier and not ignore, the joint pain. So if you have joint pains, it's not settling, you can always also ultrasound that joint, make sure that there isn't inflammation or anything in the joint that we need to treat. And if we're treating an arthritis correctly, we should not lead to the disfigurement that you see in some of the pictures that I've got. That's in the times when we never had treatment or we're not treating the disease to target. Yes, we do still find a lot of these patients, and the biggest challenge we as rheumatologists face in practice is that patients are actually referred to us too late. So by the time a patient comes to us and they've got deformities or they've got damage, we don't have any medication that can reverse the damage. And that's why we need to treat these patients before they damage their hands. If you look at the picture on screen and you see what deformities that is, a patient will not be able to clasp their hand. You cannot open a door. You cannot open a tap. You'll be able to do nothing with hands like that. And just think about you sitting in front of you. How many times did you need to use your hand in everything that you did today? It's a very important part of function.
Okay, we will now take a break. We'll take a short ad break and return to Health Matters. Assalamu alaikum. Welcome back to Health Matters. We have Dr. Ayesha Wadee, a rheumatologist in private practice, who is speaking on joint pain and focusing on arthritis today. I would just like to remind the viewers to please call in with your questions, concerns, worries regarding any stiff joints or pains. The number is 011 086 7701 or 2 or 3. Dr. Wadee, I just wanted to check out with you something that we often hear, patients complaining about the weather and attributing more severe pain to cold weather. What would you say to that?
Look, most patients that do come to practice do complain of joints getting worse in cold. In terms of scientific reasons for that, we don't have, it's not a specifically identified thing, but what we do know is immobility does make joints a bit more stiff and a bit more painful. And what generally happens is, specifically when it's colder, most patients are less mobile. And when you're less mobile, you do have more stiffness of your joints.
And I've often heard from patients who speak to using the bean bags. They warm it and put it on the affected parts of the body. Would you say that does ease the pain? What is your response?
Heat therapy does impact on pain, and it does help in terms of pain. right? Heat works on specific pain sensors, and they do improve pain. They also improve the muscle tone, and they relax the muscle, and a lot of the time, you know, you have spasm of the muscle, which also influences the pain. So the pain may not be from the joint itself, but is more from like spasm of the muscle and the surrounding tissue. Heat and you know, specific thermal therapy is known to be beneficial to you.
Something that is of concern is that how can parents tell when their children are little that there is something wrong? As you mentioned earlier, that arthritis occurs across the spectrum, even with very young children. So what should parents look out for in their young children?
Look, from the point of view, I'm mainly an adult rheumatologist, but from pediatric knowledge, you know, the important thing is to look at the movement of the child, see whether they're walking normally, whether they're limping on a certain limb, whether they're trying to avoid pressure or, you know, playing or running on in a certain way because of abnormalities. Look at their posture and look at their normal alignment. So, you know, whether they hand or leg is rotated in a different way. You can also observe the swelling. Then you may find growth abnormalities. So important to any patient that has a chronic disease may have an abnormality in growth. Either they grow too fast or they suddenly have this decreased growth, which can impact their joints. And look, another thing is swelling of their joints. And again, with children, look for other signs. Fevers are important, rashes are important. An unexplained fever very often in a child may also be a sign of an autoimmune disease. So if a patient has an unexplained fever, not all fevers are related to infection. And if you don't, once you've excluded infection, autoimmune diseases are something that also needs to be checked in children.
So when parents talk about growing pains, is there any validity in that statement of the child is experiencing this kind of pain and they attribute it to growing up?
You may have some pain when you have some growth spurts because of metabolically active bone in your body, but it's not, you know, if your child's having chronic pain, rather have it checked out.
Okay. Just a reminder to viewers out there, we are taking calls on 011 086 7701 or 2 or 3. What else would you like to speak to in terms of arthritis? What would you like to bring to the attention of the viewers?
Maybe since we got a little bit of time, maybe to focus on not just the arthritis, but the other organs in the autoimmune diseases that are also part of rheumatology, okay? And things like, you know, lupus per se is a multifactorial, a multi-organ disease. So besides affecting the joints, it may affect other organs of the body. You may have specific rashes. You could have rashes on the cheeks of the body. You may have hair falling out in significant patches, giving you bald spots. And another thing you need to look out for is, especially in young girls, if they have the hands changing color in response to cold, that is something which we need to check out as well, because some of the autoimmune diseases may manifest as what we call Raynaud's, and this is a color change that occurs in the fingers in response to cold. So they may, whenever it's cold, they may actually go red, blue, or white, and you may get 2 out of the 3 colors. You may get different forms of rashes that heals with scarring. They may have changes in the skin. Look for muscle abnormalities, weakness, specifically in some of your muscles, like suddenly you can't get out of a chair without help, suddenly you can't climb steps without help. When you have difficulty or weakness in terms of combing your hair and doing anything that requires what your so-called proximal muscles and those weakness, those are also features of autoimmune diseases that need to be checked out. There's also other diseases which give you specific dryness. So patients who have severe dry skin, dry mouth, dry eyes, get mouth sores, get eye sores because of the dryness. That's also one of the autoimmune disease, Sjogren's, which can affect other organs in the body. So if you have any sign or symptoms of autoimmune disease which cannot be explained, you also need to have it checked out to make sure you're not missing an underlying disorder.
I want to ask you a question. We find that a lot of people go to alternative therapists for treatment, they go to hakims for treatment regarding arthritic pain. What would you say to that?
In terms of diseases with arthritis, there are a lot of arthritis, okay, and there's a lot of different therapies. I'm not going to shoot down any profession and say nothing works. At the end of the day, cure or anything comes from Allah. We know that there isn't cure, but we know that there are treatments, okay? Medical treatments are also formulated from natural therapies. I don't have the expertise in terms of knowing every natural product out there, so I can't comment on the effectiveness. But even with us, we do know that there are some natural products that do work on pain. For example, a thing like red pepper or capsaicin is one of the things that we find in red pepper or cayenne pepper, and that we know is one of the modulators of pain. And a simple thing like rubbing red pepper or cayenne pepper with cream onto certain areas can alleviate certain types of pain, specifically things like nerve pain. But to say that you shouldn't have medical treatment, that's a bit of a worry. Remember, yes, there are alternative therapies, but when you got an immune-mediated disease, if you got rheumatoid arthritis, immune-mediated diseases like rheumatoid arthritis are multi-organ diseases. They affect organs. They can lead to death. Please rather get treatment and get advice from a doctor. I know it's very scary to take medication. When we give you medication to treat immune-mediated diseases, a lot of people are afraid because they say, here, the doctor wants to give me a medication that's used to treat cancer, it's used to treat this. I sometimes tell my patients that think about these abnormal immune systems. In a thing like rheumatoid arthritis, you've got an abnormal immune system which is attacking your body. Cancer, in a way, is an abnormal cell in a certain organ. These diseases are not, the medication is not because you've got a cancer, but we want to treat the abnormal cell. We want to suppress the abnormal antibody which is attacking your body. And if you don't treat that, you know, it's very difficult when patients come back a few years later when they've got damage to organs, when they've got damage to the joints, and then they come and say, doctor, help me. It's too late to reverse damage. Things like lupus can affect your kidneys. It can kill your kidneys. You may land up being on dialysis or needing a transplant. It's not very easy to get that. It changes your quality of life. Again, I've said that if you have these diseases, they increase your risk of cardiac disease, they increase your risk of osteoporosis, they increase your risk of fractures, they increase your risk of immobility, they increase your risk of pneumonias. So we do need to treat these diseases.
Doctor, we are coming to the end of our program, and if we can just summarize and give people out there just take-home messages that you can leave them with.
As a take-home message, your joints are an important part of your body. People don't take it seriously. I know it's not as important as the heart, but you can't be functional if you don't have your joints to be functional. Don't ignore joint pains that go on without finding a cause. And rather go and seek attention, go to your GP, let your GP refer you to a physician or a rheumatologist if need be. You'd rather be told there's nothing wrong than avoid something that is wrong.
Okay. I would just like to take this opportunity to thank Dr. Ayesha Wadee on a very informative presentation. And in ending, I think people need to understand that this is more of an advice session and providing guidelines, but people need to obviously seek medical consultation and attention. So contact your nearest GP or physician. And in ending, I would like to just end with a closing verse from the Holy Quran. وَالْأَسْرِ إِنَّ الْإِنسَانَ لَفِي خُسْرٍ إِلَّا الَّذِينَ آمَنُوا وَعَمِلُوا الصَّالِحَاتِ وَتَوَاصَوْا بِالْحَقِّ وَتَوَاصَوْا بِالصَّبْرِ. Jazakumullahu khair. We will flight Health Matters next week on ITV, and which will be organized once again by the Islamic Medical Association of South Africa. Assalamu alaikum wa rahmatullahi wa barakatuh.